Hi, if you have symptoms like irregular or absent menstrual periods or cycles, you're finding it difficult to get pregnant, maybe you've been trying for a long time and you couldn't conceive, or you have excess hair on your face above your chin or on in the beard area, then your doctor may have advised you to do something called the LH to the FSH ratio test or the LH-FSH test. And today I'm going to tell you everything about this test. First of all, what is the LH and FSH? LH stands for Luteinizing Hormone and FSH stands for Follicle Stimulating Hormone. As the name suggests, these two are hormones in your blood. They are made by a small organ present in your brain. Their roles are to regulate your menstrual cycle and to promote proper fertility. The luteinizing hormone is responsible for releasing a single egg during each of your menstrual cycles, and the FSH or follicle stimulating hormone is responsible for causing this egg to mature or develop properly before it is released. Now, the LH and FSH are both separate blood tests in themselves. The LH blood test will measure the levels of the luteinizing hormone and the FSH blood test will measure the levels of the FSH hormone. So why do we need a ratio of these two levels? That is because it has been found that there is a specific or fixed ratio of these two levels all throughout your cycle. It changes throughout the cycle but within certain limits. And when this ratio is disturbed, you develop all these kinds of symptoms, especially the most troubling one of all is infertility. And that is why doctors not only measure the levels of the individual hormones themselves, but their relative proportion or ratio, and that is why this test is called the LH to FSH ratio. Some symptoms that may mean that you need to get this test include irregular periods, infertility, complete absence of your periods, excessive hair on your face, weight gain, a lot of acne, thinning hair or maybe male pattern baldness, and a darkening of your skin. All these are signs of an improper hormonal balance, improper balance of the fertility hormones, and so we recommend this test. So what are some reasons because of which your doctor may have advised this LH to FSH ratio test? The first and most common reason is called PCOS or polycystic ovarian syndrome, a syndrome in which a woman has high levels of male hormones in her blood. She develops facial hair or acne and a lot of disturbances in her menstrual cycles. The LH to FSH ratio helps us to diagnose this condition. The next could be infertility, where you're not able to conceive despite trying naturally for almost a year with your partner. Other than this test also helps us evaluate the proper balance of hormones in your blood, whether the pituitary gland, which is a tiny little organ in your brain which makes these hormones, is even working properly or not, and whether there may be some kind of disease in your ovaries because of which they are not working properly. All these things can be judged by means of this blood test. So how is the LH to FSH ratio blood test performed? This is just a simple blood test. You need to provide a single sample of blood, and this must be done preferably on the third day of your cycle, at least between day 2 to 5. The test will actually measure the levels of the two hormones LH and FSH and also provide you with a proportion of the two, that is just the value of LH divided by the value of FSH. There's no special preparation required. We usually recommend that you provide the sample in the morning and inform the lab if you're on any kind of contraceptives, hormones or any kind of supplements which could possibly affect the results of the test. You will have the results on the same day or probably the next day with most labs. What is the normal level of the LH to FSH ratio? Well, the normal ratio in most women in the early part of the cycle should be less than 2. That means the level of LH can at most be twice as much as the level of the FSH, but not more than that. Around mid-cycle or during the time of ovulation, your LH levels will surge and so this ratio will rise. But because we measure it in the early part or within the day 2 to 5 of your cycle, we are only interested in the normal range which is established for that period of the cycle, which should be around 2:1. Now, what happens after menopause is that your FSH levels tend to rise more than the LH levels and so the ratio gets inverted. Important to note that in conditions like PCOS, this ratio is usually more than 2:1, and that's what gives us a clue that there is something wrong with your hormonal balance in cases of PCOS. What do the results of the LH to FSH ratio tell us? So this is a rather complex test to interpret, and it is best left to your gynecologist or endocrinologist to actually interpret these results. But here I've given you a few simple ideas. If the LH to FSH is more than 2:1, that means the LH level is more than twice the FSH level, it could go in favor of PCOS or polycystic ovarian syndrome, but this has to be confirmed together with other tests as well. Secondly, if there is something wrong with your ovaries, this could be an infection or a disease of the ovaries because of which your ovaries are not working properly. We will find that both the hormones are actually high, so the individual levels of the LH and FSH will rise. The ratio may stay the same or it may even get altered a bit, but this depends on exactly what the problem is. Another situation in which your pituitary or your hypothalamus, which is the part of your brain that makes these hormones, if that is not working properly, the individual levels of the LH and FSH will actually be low because they're not being made in enough amounts, and the ratio would also change. So it's important to note that this ratio is a rather complex thing to interpret, and except for PCOS, where we definitely find a value which is greater than 2, you should consult your doctor to understand what the report actually means in your case.